So after sodium fluoride, let us continue with the second compound, that is stannous fluoride. Stannous fluoride was developed by Muller and his co-workers, and it is available in two concentrations, 8% and 10%. So if you remember, the sodium fluoride is available in 2%, whereas stannous fluoride is available in 8% and 10%, of which 8% is more frequently used. So coming to the method of preparation of stannous fluoride, stannous fluoride solution is very unstable. It is unstable, and hence you need to freshly prepare the solution every time. So when we talked about the advantage of sodium fluoride, we said that sodium fluoride is stable when stored in plastic containers. Hence you can prepare it in liters quantity. Whereas when you talk about stannous fluoride, it has to be freshly prepared every time. So if you have noticed, the preparation of stannous fluoride, it is done by mixing 0.8 grams of stannous fluoride in 10 ml of water. So while sodium fluoride was prepared in 1 liter of water because it can be easily preserved, whereas stannous fluoride needs to be prepared fresh every time you are dissolving 0.8 grams of stannous fluoride in 10 ml of water, and hence the concentration is 8%. And this is available either as a gel or solution. The most commonly used is solution, and the technique of application for stannous fluoride is known as Muller's technique. So for sodium fluoride, we had the Knudsen's technique. Similarly, for stannous fluoride, we have the Muller's technique. So it also, again, similar to the sodium fluoride, it begins with thorough prophylaxis, isolation and drying of teeth. This can be treated like the sodium fluoride itself, either quadrant-wise or sextant-wise or half-mouth, it can be treated. Now, one difference when in Muller's technique compared to the Knudsen's technique is that here, once you paint it on the tooth surface, you have to continuously keep it wetting for a period of 4 minutes. So there in sodium fluoride, you are just applying once, you are allowing it to dry, whereas here you apply once every 30 seconds. You keep continuously wetting the tooth surface with stannous fluoride. And the technique is basically a paint on technique, and because there is no choking off effect here. So when we come to the mechanism of action, I'll tell you, here there is no choking off effect. So the more stannous fluoride is added, the more gets into the tooth structure, and hence the next appointment has to be scheduled only after 6 months. So the recommended frequency of application is only once or twice per year, unlike sodium fluoride, which has to be applied for 4 consecutive weeks because of the formation of calcium fluoride in the choking off phenomena. So here that is not there, and hence you need to schedule the appointment next only after 6 months. So coming to mechanism of action, the mechanism of action of stannous fluoride is totally different. 4 compounds are formed when this stannous fluoride reacts with enamel. They are tin hydroxyphosphate, tin trifluorophosphate, calcium trifluorostannate, and calcium fluoride. And calcium fluoride, which is formed, further reacts with hydroxyapatite, form fluorohydroxyapatite. This tin hydroxyphosphate gets dissolved in oral fluids and is responsible for the metallic taste. So one disadvantage of stannous fluoride is the metallic taste because of the formation of tin hydroxyphosphate. The main end product is tin trifluorophosphate, which is responsible for making the tooth more stable and less susceptible to decay. And the calcium trifluorostannate also has similar properties. So 4 compounds are formed. One is tin hydroxyphosphate, tin trifluorophosphate, calcium trifluorostannate, and calcium fluoride. Of this, tin hydroxyphosphate gets dissolved and gives a metallic taste. It also results in staining of tooth, whereas tin trifluorophosphate and calcium trifluorostannate, they have the anti-carcinogenic property. And when you compare sodium fluoride, stannous fluoride, and APF, stannous fluoride is very powerful, and it is the most efficient among these 3, and hence, because of the drawback, one is the metallic taste and the staining property, the use of this is restricted only to rampant caries, where aesthetics is not a concern. So that is probably the only indication of stannous fluoride. In spite of its increased efficiency, the major drawbacks, which include the staining of tooth and the metallic taste, make it used only for a condition like rampant caries, where you don't have any concern regarding aesthetics and your main objective is to just arrest the progression of caries. So the advantage of stannous fluoride is that it is very effective when applied to teeth. you would require only a semi-annual application, that is once in 6 months. And the mechanism wise, it is one of the most efficient topical fluorides that can be used. The disadvantage, it is a highly unstable solution. It has to be freshly prepared. The pH is low, that is 2.1 to 2.3. It is quite irritating to the soft tissues. It has a metallic taste. It causes gingival irritation. It produces dark brown discoloration, or it also stains the restorations like composite restorations, and these are the potential disadvantages of stannous fluoride. The third compound is called the acidulated phosphate fluoride that was introduced by Bruderwold in 1963. The concentration is 1.23%. So just recollecting, sodium fluoride is 2%, stannous fluoride is 8%, and APFS 1.23%. The pH ranges from 4 to 5. It is the method of application. It is prepared by dissolving 20 grams of sodium fluoride in 1 liter of 0.1 molar phosphoric acid. And to this, 50% of hydrofluoric acid is added to adjust the pH at 3 and the fluoride concentration at 1.23%. So here it is not distilled water, you are dissolving it in 0.1 molar phosphoric acid. To this 50% hydrofluoric acid, just correct the spelling, this hydrofluoric acid is added to adjust the pH at 3 and the fluoride concentration at 1.23%. And to this, if a gelling agent like methyl cellulose or hydroxyethyl cellulose is added, this is converted to gel. The most commonly used method of delivery of acidulated phosphate fluoride is gel and not solution. So the method of application, if it is solution, it is the paint on technique, and if it is gel, it is a tray technique, and the technique is known as Bruderwold's technique. So Bruderwold's technique, the most preferred method is the paint on technique remains the same as stannous fluoride. You use to keep continuously wetting the tooth surface over a period of 4 minutes. The rest all are exactly same. Whereas when you come to tray technique, this is the method of application. The patient should sit upright in the chair. Teeth should be clean and dried. And after that, a foam tray is used. Foam tray is a disposable tray which is used for the upper and lower arch simultaneously. There are two different trays, but you can apply it simultaneously. The amount which is usually taken is less than 5 ml per tray. That is 1/3 of the tray should be filled with fluoride gel. And after that, the tray is placed into the oral cavity, and the patient is asked to exert slight chewing motions that enables the thixotropic gel to flow into the interproximal spaces. And the fluoride gel should be having a contact time of 4 minutes. And after that, like with any other topical fluoride, the patient is asked not to eat or drink anything for the next 30 minutes after the application. The main advantage of APF is the ability to deposit to a greater depth, because this is having an acidic pH. The mechanism of action, it results in shrinkage and dehydration of the hydroxyapatite crystals, which on further hydrolysis forms a compound called as dicalcium phosphate dihydrate. And this reacts with fluoride to form fluorapatite. And because of the shrinkage of the hydroxyapatite, the depth of penetration of fluoride is maximum with acidulated phosphate fluoride compared to sodium fluoride and stannous fluoride. That is the biggest advantage of use of APF gels. So the advantages, it requires only 2 applications. Again, like stannous fluoride, it is semi-annual. There is no choking off effect here also. The gel adheres to the teeth. You can, full mouth can be treated simultaneously. There is a lot of time saving when you go with tray technique compared to the paint on technique. The disadvantages, you have to use a continuous suction, because when you are using the thixotropic gel, a continuous suction is required. Because of the acidic pH, there is a slightly sour and bitter taste, and it can also cause a certain amount of discoloration when you use it with certain restorative materials like composites. There are some more newer topical fluoride agents. Just know the name, it is enough. One is titanium tetrafluoride. The amine fluoride. Amine fluoride is a type of organic fluoride, and it has more of antibacterial property as well. And the third is the ammonium fluoride. These are the various other topical fluorides that have been tested, but the most commonly used ones are your acidulated phosphate fluoride gel, and to an extent stannous fluoride as far as rampant caries is concerned. That is all about professionally applied topical fluorides. These are all applied by the professional. Next, coming to the self-applied topical fluorides, we just have 2 products. One is the toothpaste, that is the fluoride dentifrices, and the second is the fluoride mouth rinses. So most of the fluoride toothpaste that are available now in the market are all fluoridated. This, what you should know is, here you don't have sodium fluoride as the ingredient. The most common additive here is sodium monofluorophosphate or stannous fluoride or amine fluoride, whereas sodium fluoride is not at all used because it reacts with the abrasive present in toothpaste and results in reduced bioavailability. Hence, sodium fluoride is not the ingredient used in toothpaste. So most of the toothpaste, if you look into the ingredients, it has a fluoride concentration ranging from 800 to 1200 ppm. So this is the usual range of fluoride present in your toothpaste. And if it is a toothpaste for kids who are aged less than 6 years, usually the concentration is about 225 to 300 ppm of fluoride, because it is not that it causes fluorosis, but whenever kids, there is a habit of swallowing the toothpaste more rather than expectorating it. So whenever the toothpaste is swallowed, amount of fluoride that reacts with the gastric HCl to form HF, which is a gastric irritant. Hydrofluoric acid that is formed is a gastric irritant, and hence fluoride toothpaste are not very much recommended for children less than 3 years of age, because of the risk of swallowing and resulting gastric irritation. No other toxic effects can occur, and hence less than 3 years, usually no fluoridated toothpaste is recommended. 3 to 6 years, once the use of fluoridated and once not fluoridated, and beyond 6 years, twice a use of fluoridated toothpaste is recommended. Alternatively, kids' toothpaste can also be used. The usual concentration is 225 to 300 parts per million. The second is the fluoride mouth rinse. So in fluoride mouth rinse, the additives that are used are usually sodium fluoride, stannous fluoride, and APF. And when sodium fluoride is the most commonly used one, the concentration is 0.2% for a 900 ppm rinse, that is for weekly use, or a 0.05%, which is a 225 ppm for daily use. So the most commonly used ingredient in mouthwashes is the sodium fluoride, 0.2% for weekly use and 0.05% for daily use. So lastly, coming to what are the other recent advances in topical fluorides. Topical fluorides, they are incorporated in various other products for providing a slow and sustained release of fluoride in the oral environment. So one, as you all know, some cements like glass ionomer cement or zinc polycarboxylate cement contains fluoride. Fluoride containing alginates are available, fluoride containing amalgam or fluoride releasing materials in orthodontic treatment, which could be the fluoride containing etchants, fluoride containing elastomeric chains, fluoride incorporated in dental floss, and you also have intraoral fluoride releasing devices that release fluorides slowly over a period of time. So these are all various recent advances in topical fluorides, and to an extent you can also talk about chewing gums which contain fluoride. That is also another method of topical delivery. So these are all the various methods of topical delivery. So far what we have discussed is topical methods of fluoride delivery. In that we can classify it as self-applied and professionally applied. And in self-applied we have toothpaste and mouth rinses, whereas in professionally applied you have solutions, gels, thixotropic gels, prophylactic paste, foam, and varnish. The most commonly used chemicals are sodium fluoride, stannous fluoride, and acylated phosphate fluoride. These are the most commonly used preparations of topical fluorides. So that finishes the topic on topical fluorides. Next week we'll continue with the last topic in fluoride, that is the systemic fluoride, where instead of the topical effect, we will study about what are the methods by which the fluoride is given systemically. So with that, we wind up today's class. Thank you everyone.